Um, I woke up to this sad news, and about a woman, a nurse that has dedicated her entire life saving women and children during childbirth. Now it was her own turn to have her own baby, and she dies during childbirth. That's not fair. Trust me, I've done this video like 5 times and I just couldn't hold back the tears. That's not fair. This video is just a tribute to her. Sincerely, I have nothing to say.
Before I go to bed tonight, I wanted to make a video honoring the life of Dr. Janelle Smith. I just made a video, but I was not able to keep myself together, so I want to try this again, because this is not about me. This is about Janelle. I learned this evening of Dr. Janelle Smith. She is a midwife in South Carolina who dedicated her entire life to making sure that people felt safe in childbirth. And Dr. Janelle passed away yesterday during childbirth, trying to deliver her very first baby. I looked her up, and I really need you to go and see who this woman was and is. The comments from her patients who she cared for spoke volumes of her character, of her compassion, of her knowledge, of her strength. And although I never met her, I am devastated of the impact of her loss. Not just her friends, her family, her coworkers, but the patients that she cares for. I don't know what happened, but I need you to understand that Black maternal mortality is real. It does not care who you are. It does not care what you know. It is real. And for Black women, going in to have a baby is one of the scariest things that they will do. So stop being offended if Black women don't trust you. Listen to what they want. Listen to what they need. And when they tell you something is wrong, something is wrong. My sincerest condolences to everyone who is impacted by her loss. And to Dr. Smith, thank you for the care that you provided your patients. And I hope that you're able to rest in knowing that there are so many out there that want to continue your work in helping people feel heard and safe. Rest easy, sweet girl.
She was a nurse midwife. She was a doctorally prepared expert in maternal care, and she died from childbirth complications. Today, I want to honor Dr. Janelle Smith. Dr. Smith was a certified nurse midwife and a doctor of nursing practice who dedicated her career to maternal health, safe childbirth, and patient advocacy. She supported hundreds of families through pregnancy and birth and was deeply respected by her community and within this profession. So, according to statements from professional organizations and community tributes, Dr. Smith died from complications related to childbirth shortly after delivering her first child. No additional clinical details have been publicly released, and it is important to be clear and respectful about that. We do not speculate. What we do know is enough. A Black woman who spent her life caring for birthing people, a highly trained maternal health expert, someone with education, experience, and access to care, and she still died. This is not an individual failure. This is a systemic one. Black women in the United States are 3 to 4 times more likely to die from pregnancy-related causes than white women. That risk does not disappear with advanced degrees, professional status, or proximity to healthcare. Dr. Smith's death painfully reinforces that truth. We honor her by recognizing her contributions, her impact, and her humanity. And we honor her by refusing to look away from what her death represents. Black maternal mortality is very real. It is ongoing and it demands accountability. Rest in power, Dr. Smith.
This video is in honor of Dr. Janelle Greensmith. I want to pause before I continue to talk that if you are not in a good headspace, please stop watching this video. Dr. Janelle Smith is a midwife who dedicated her life to helping women bring in healthy babies and also make sure that they survived their deliveries. Well, unfortunately, she lost her life delivering her first baby. Now, there's a lot of information that hasn't been shared, but there is one thing that we do know, and that is the fact that Black women are statistically more likely to die giving birth in our country, 3 times more likely to die. And as we wait to hear what happened, I want to highlight the fact that what we do know happens is the fact that when Black women share that something's wrong, when they say that something isn't right, we are consistently not believed. And because of that, we lose our lives. We lose our lives or our babies' lives or both. And it's got to change. It's not acceptable for any woman, for any person to lose their life. But we also need to recognize that there is one group that is at the highest risk for losing their life giving birth in this country, and that is Black women. My condolences goes to Dr. Janelle Greensmith's family. May she rest in peace.
Anytime I see a headline like this, it literally stops me in my tracks. Fortunately, it's not because I'm surprised. It's always like another one. Dr. Janelle Greensmith, who was a South Carolina-based midwife, who dedicated her life to advocating for Black women and safe childbirth, died during the birth of her first child. She was a trained midwife who was deeply knowledgeable, and yet she still died from complications of childbirth. I want to be very clear. This is not about blaming one provider, one hospital, one decision. Maternal deaths are almost never caused by one single factor. What this continues to highlight time and time again is how broken and fragile our system is, especially for Black women in childbirth. Delays in recognizing complications, breakdowns in communication, bias, postpartum care gaps are still a very, very, very real problem. It can happen to someone who knew the warning signs, who advocated for others every day. It tells us that this is bigger than individual choices. This is a systems problem. Matter include being heard, being advocated for, having providers that you trust, clear postpartum warning signs, timely escalation in care, and accountability in our systems. We cannot track what we cannot measure. Hospitals have to do a better job of identifying and tracking these things. Honor her by talking about this honestly, pushing for better systems, and refusing to normalize preventable maternal deaths. This conversation is not meant to spark fear, about awareness, systems, and accountability. If you're pregnant and postpartum and something feels wrong, say something. Advocate for yourself. If you're a healthcare worker or someone in training, advocate for your patients. Take additional time to learn the warning signs and fight implicit bias. This is all around us, and it's on us to be the first to stop it.
Say her name, Dr. Janelle Greensmith. Say her name, Dr. Janelle Greensmith. The nursing community, we are heartbroken today, learning that she lost her life moments after giving birth to her baby daughter, baby Eden. Baby Eden survived, but mom didn't. And we know this story time and time again, but this time it was one of us. And she devoted her life as being a midwife, as she delivered over 200 babies. But sometimes, I'm speaking from experience as a nurse, over 30 years, I will put my patients, I will put the job, I will put a lot of stuff before I put my own health. It was times that I could sit at the nurse's station and couldn't even take a break, couldn't even go to the bathroom because I had patients calling and I didn't want to take that moment out because I wanted to deliver excellent care. Dr. Janelle Greensmith, our heart goes out to you. We're praying for the family and praying for baby Eden. Guys, let's make sure we pay attention to our bodies. Nurses, self-care is the best care. Remember, we can't take care of anybody else if we can't take care of ourselves. And when we feel that little pain, we be like, oh, that's just nothing. Oh, this, that. See about it. Say something, get it treated. Because sometimes nurses are the worst patients. Well, you know that and I know that. Dr. Janelle Green-Smith, well done. You will always have an impact on the nursing world. And God, we're going to ask that He continue to wrap His arms around your daughter, the father of the child, your family. Say her name again, Dr. Janelle Green-Smith. We got you in our hearts forever. The nurse community is broken right now.
I actually don't know how to start this because here I am, I'm at work, and I woke up this morning to opening a story about a nurse midwife, Janelle Green-Smith, who died in childbirth. A midwife, a woman who basically gives her life or more life, has lost hers after bringing in her first child. And she's not the first, but the second person I've heard pass away in 2026. We are on day 4. 2 Black women. I'm here in the building where I get to do something that I love. But hearing these stories makes it so painful because it's just not supposed to be okay. It's not supposed to happen. I don't even know what to, I'm just sorry. My condolences. My condolences to her family, to her husband, who just lost his best friend, his wife, the mother of their first child, all in 1 second. I don't know. All right, I gotta go. Okay, so I'm trying not to be emotional, but we need to take a moment to remember Dr. Janelle Green-Smith. She was a Black midwife who dedicated her life to improving maternal outcomes during pregnancy and birth. And that's one of the reasons I became a birth doula, because I know the disparity of care that Black women receive during pregnancy and birth, and they have like poorer outcomes than white women. And it's systemic. It's due to systemic racism. One of the reasons I know this is because women who immigrate here, say from Africa, that are Black, right? Africans, who didn't have poor maternal outcomes in their countries of origin, when they come here, their maternal outcomes are like the same as if they were born here. So it's not a genetic thing. It's a medical thing. It's how they're treated thing. It's a systemic racism thing. And for her to die during childbirth is just such a tragedy, and I hope that it shines the spotlight on the disparity of care. I just don't have many more words. May she rest well. Rest well, warrior.
Dr. Janelle Green-Smith. Say her name. She is a doctor of midwifery, and she lost her life giving birth to her first child. She is a Black woman in America who has all of the know-how on babies and childbirth and all of that, and she lost her life delivering her first child. I have worked with a family recently where the mom unfortunately lost her life during childbirth. And supporting a family that is not only grieving the loss of a spouse, but also having to figure out how to be joyous for their child who did make it, and grieving the loss of someone that they love, but then also trying to not resent the child is something that no family should ever have to go through. Maternal mortality is a much, much, much bigger problem than we will ever fully grasp and admit in the United States. It is pathetic that we are the wealthiest, most developed country in the world, and yet we have the highest maternal mortality rate of any developed country. Make it make sense, because it doesn't. Dr. Janelle Green-Smith will be missed and will be honored forever. And hopefully her story and her memory can help to save a life down the road, because she dedicated her life to helping women and mothers in childbirth and delivering exceptional care. It just goes to show you that maternal mortality does not care who you are, and it is horrifying. We need to do better for new moms everywhere.
Hey y'all, my name is Janelle and I am a board certified nurse midwife. I'm gonna tell you a little bit about my journey and what brought me to midwifery care. So I started my career in undergrad nursing. I graduated, I became a neurology nurse, hated it. And then I decided that women empowerment was my thing. So I transitioned over to high-risk labor and delivery, where I began seeing the systems in the hospital and how women are treated during pregnancy, labor, and birth. And I wanted to be the change. So I went back to midwifery school and I got my master's degree in midwifery. I worked at a freestanding birth center for about 2 years, loved it, learned all things midwifery. And then I decided I want a little bit of another change. So I joined a hospital-based practice where I expanded my career and I now do B1acks. I'm with a team that offers inductions of labor. We offer our patients epidurals, water births. So we have a plethora of options for birth and midwifery care. About a year ago, I got my doctorate in nursing, where I led a quality improvement project engaging the care for obesity in pregnancy. So a lot has gone into this degree and this field of midwifery, and I'm very passionate to share that with you guys. So comment below if you have any questions about my journey or general midwifery questions that I can answer for you.
Sorry guys, if I'm not able to articulate my words properly. This is just so sad. A woman that has given her life to saving others, and now she needed saving but couldn't be saved. This touches me because I'm a mother as well, and I know how much a mother looks forward to having her baby and holding her baby in her arms. It hurts. It hurts. It's so painful. It's so painful.